So we'd like to introduce Paul Downs to you all. So I'm sure he'll be able to introduce his role and the organisation that he works for a lot better than I can. And he's going to share a presentation with you around disability inclusion. So welcome, Paul.
Thank you, Mary. Hi, everyone. I hope you're well. Yeah, I'm just going to share my screen if that's possible. So let's hope the technology works. Just bear with. Can you guys see that okay?
Yeah, we can.
Yes,
So
we
yeah,
can.
I can't see any of you anymore, unfortunately. So I'm gonna have to I'll try and work that out if I can. Don't think I can, but never mind. But if you can see the slides, that's all that counts. So yeah, thank you for having me this evening. So in terms of my name's Paul Downs. I'm the Strategic Partnership Advisor for the Activity Alliance covering the Yorkshire and Humber region. And in terms of, I've been asked to come here tonight to, because I liaise with Mary and Laura, and we've been speaking about, bringing some information and guidance that we've got the Activity Alliance, and want to talk about the Alliance, not just the sort of the internal team at the Activity Alliance, but also all the members and the partnerships that we have across the country. So yeah, when we talk about the Alliance, it's a more of a kind of a wider community of organisations and membership that we have at the Alliance. So a little bit of background on who we are. So we're a national charity and we're the leading voice for disabled people in sport and physical activity. Established more than 25 years ago, and as I said, we're a membership organisation working with lots of different partnerships, and we're working closely with disabled people to make sure that we get that true voice, that lived experience voice of the disability community. Trying to change attitude towards the disabled people and embedding inclusive practices and inclusion in sport and sport development, grassroots sport, right throughout really. So in terms of, we do have a workshop that's a bit more kind of intensive, and I'm going to try and hopefully cover most of this information in the 20 minutes that I've got. But yeah, if hopefully kind of we can give you kind of a bit of information, setting the scene of what we do as an organisation, look at the research and insight. Hopefully give you some sort of pointers into sort of how to engage with your disabled communities, look at some inclusive communications and improving accessibility, and we'll go through some of those barriers that disabled people face, unfortunately, across society, and then hopefully we can give you some pointers, some guidance, and some signposting to some potential solutions as well. So yeah, it's about, I suppose, building confidence, giving you a bit of insight, and then creating some links as we go forward. So yeah, I think one of the kind of from the brief that Laura and Mary gave me were, the people that you want to reach, and starting off with getting to know your audience and how best to reach out and engage with them. So I think that's something that that you all probably in terms of if you grow in that disability or inclusion section to your clubs, it's about kind of targeting who you want to reach and within the different sports that you cover. Just to give you a little bit of information in terms of the disabled population and how that links with activity, you'll see that top right box there. So in Yorkshire and Humber region, 26% of people are disabled. And we won't go too much into the stats, but there is some quite high numbers. 1 in 4 total UK population is disabled. And when we're talking about disabled, the definition of that is taken from the Equality Act, and it's something that we always refer back to in terms of when we defining disabled people. And we've got lots of information such as this in fact sheets on our website, and I can share that with you in the chat as we go through. Just another couple of sort of headline stats, really. One that I'll dwell on more is around the 75% of disabled people have one more impairment, more than one impairment. So when I think back to when I worked in my previous role with Sense, we were working with supporting people with complex disabilities. So yeah, a lot of people, 75% of people living with either, multiple disabilities, impairments, or long-term health conditions as well. So within that sort of, in terms of how you approach the disabled communities, we would definitely always advise a person-centered approach. So getting to, I suppose, consider what will challenge and improve your approach. And within that, we sort of like got four elements here. So it's understanding, then connecting, engaging, and learning and sharing. And when it comes to sort of understanding, so it's getting a strong insight on people's preferences, and really trying to take the time to understand that what those adjustments are to maybe to help that individual take part in a sport. In terms of connection and how you connect, there could be many different ways to do that with the diversity of populations and those intersections and thinking about that intersectionality piece. But we need to obviously sort of give individuals and supporters or organisations a platform. So it's about co-designing and communicating in an appropriate manner. And we've got fact sheets and guidance to help you do that. In terms of, I suppose, that engagement, so when you're doing the collaboration with sort of that new community, it's about listening and consulting, using their expertise, their lived experience to ensure that you're getting a true voice, and that co-design will sort of develop your understanding, their understanding, and hopefully will bring a solution to sort of to how inclusive and how accessible a session can be, and how a sport can be. Learning and sharing, obviously sort of we're doing this constantly, and we have lots of research and insight that comes through from working with the various organisations that we have, and it's learning from potential mistakes that you make, and we're always learning all the time, but we're definitely looking at how best we sort of share that experience, share the learning. Do you know what good service looks like for your audience? Are your evaluation methods accessible for people with different impairments? So it's making sure that you go that extra mile to find out what it is the experience was like when you've got that structure in place. So just in terms of the principles, then process of engagement. So yeah, obviously those benefits there. So it's like we want you to try and gain local insight and intelligence. So it's understanding what communities are out there in your localities, and then how can you consult with those groups to deliver a set of improvements for opportunities. Communication and reach. We'll go into sort of like inclusive communications a bit further down the line, but yeah, improving those connections with your disabled community, knowing what groups are out there, and using existing communication systems as well. So there's some great services that are already out there that you might be able to tap into, and it's getting that maybe that local knowledge that some organisations can definitely help you do. And then that last around workforce development. So it's about building the skill set, building the understanding, and we've got some great examples of that across our website and other organisations, and there's some great resources that are online, at the active partnerships that are here, and also through Buddle as well, which I think we might be looking at later on. So just I'm not going to dwell on that one too much. So yeah, just wanted to skip through to the resources. So we have got some, like I said, we've got some really strong resources that are on our website. And you can really tap into them sort of as and when you want to. We've also got a learning hub that's just launched recently. So this is going to provide the support, hopefully at an arm's length. But then you've also got advisors like myself that are in the region. So hopefully they'll give you a sort of like be a great first step really in terms of that effective engagement. And within these fact sheets, they cover lots of different elements of health and children and young people's advice, and also kind of the aging population as well. So there's some really strong, and it goes down to impairment specific as well, and they're all available, like I said, on our website. So when we're looking at the that co-production and co-designing sort of elements to a grassroots sports club or community group, just sort of taking into consideration, I suppose, some of these equality, diversity, the accessibility, and it's, I suppose it's just making sure that you've done the research and due diligence really, just to kind of covering all elements. In terms of these headings of equality, firstly, we have equality. This principle ensures that no group or individual is seen as more important than any other. So in co-production, every voice is valued equally. And this balance is essential to ensure that the final decisions, the outcomes, are fair, and it's a reflective kind of perspective from everyone. In terms of diversity, we're finding diversity and inclusion are fundamental really to the co-production process, and by involving people from different backgrounds, experiences, perspectives, creating that solution that are hopefully more robust, equitable, and effective for everyone involved. And then in terms of accessibility, there's lots of information, like I said, that's out there. But for co-production to be, I suppose, 100% are truly inclusive, the process must be accessible. This means ensuring that everyone, regardless of their needs or abilities, can fully participate in a way that works best for them. So it's that person-centered approach. Always kind of going back to those 10 principles that we've got, which I'll come to in the next slide. So conscious of time, I want to try and get through a few more. So I mentioned the 10 principles earlier on. We've got it's from a document that's been around the Activity Alliance for a number of years, but we always try and advocate the 10 principles. So it's using my channels. So it's in terms of using the channels I already trust. So that's I suppose, disabled people and the different channels of communication that they use. My locality, so instead of staying local to me, we know from research that we do around our annual disability activity survey that there's disabled people will have maybe a smaller kind of community. So it's about using those trusted channels, and then there's those local people, local places where individuals can be contacted, and you can do that communication method through that. I won't go through each one of these. We have got a really strong document that goes into lots and lots of detail, but definitely think that it's something to work to. And if you go through these 10 principles when looking at engaging with disabled community, you're definitely on a right road, using these 10 principle documents that we've got. Unfortunately, I've got time to share this video, but I will put it in the information that I send over to Mary and Laura. just conscious of time. So what do we know about disabled people and their feelings about sport and activity? This information comes from our, we know a lot because we've done an annual survey. This has been taking place for the last 5 years. We've got lots of great insight and lived experience kind of voice through that's come through this. And there's also an impairment specific and demographic report as well, which I think the latest one has just come out for 2024 just recently last week. So yeah, quite up to date information. Unfortunately, from the activity survey that we've done over the last 5 years, the information the results that have come back are not telling us that the opportunities are getting progressively better. They're just kind of leveling out, which is, obviously since COVID, there's been, lots of inclusion and disability sessions had to come to an end, and some have got back to sort of starting again, which is great. But we know that a lot haven't. So yeah, and we've maybe got those participation levels that are plateaued out. So yeah, so we've got there's some great work out there, and there's some great some great models of activity, but we know that we can probably increase and drive participation rates up for the disabled community going forward over the next 5 to 10 years. But yeah, within this, you've seen sort of inclusive recovery, inclusive leaders, my active hit future, and the Talk to Me 10 principles as well. So yeah, that was back in from 2014. So we've got kind of quite a library of information and reports and insight that you can tap into to upskill your knowledge and understanding. Again, just brief kind of look at the annual disability activity survey that's been going for the last 5 years, covering elements of participation experience, the legacy of COVID, outdoor spaces and active travel. Just on that, there will be a launch of a document that's shared with Sport England that's coming out soon. So there'll be sort of a bit more information. So if there's any groups that are kind of outdoor pursuit groups and kind of those kind of sports, then there will be some more guidance coming out on that. Again, mental well-being and loneliness and representation and belonging. There's lots of information that you can delve into on those. Quite happy to share links at a later date. Yeah, in terms of just a little bit of a delve into inclusive and accessible comms, within this, we adhere to the social model of disability, and I won't dwell too much on this because there's lots of brilliant information on our website. But yeah, the medical model that you see here is it uses a lot of terminology that is quite clinical, and it's almost like the problem is the disabled person in the medical model of disability, whereas we adhere to the social model of disability, where we take that person-centered approach and include, kind of make sure that no one's excluded. And there's definitely some terminology within sport that's still using the medical model, unfortunately, and we're working with national governing body, sports, and various other organisations and institutes to try and, I suppose, yeah, raise awareness and influence more within people using the social model of disability. Again, just looking at some of the terminology around what to use and what to avoid. I won't go through these word for word, and they're not meant to catch anyone out, and we're not preaching, but it's just a little bit of awareness really on some of the terminology that is used in the medical model compared to the social model. So yeah, again, it's about an education piece. It's about people learning which terminology to use and what's avoided, and we can definitely share more information on that if you would like it. Won't dwell too much on that one. Yeah, so just in terms of communications and the considerations around when you're designing posters and or websites, and if you've got kind of if you're doing that within your clubs, it's about using things that are easy to read, using the right fonts, the right colours. People with reading visual impairments try and use these right colours. So we've got some really good guides again on our website, and we also link with some of the national disability sport organisations that can give you that. There's lots of great guidance here on this one around accessible formats, and just here in terms of the easy read options as well. So it's about using minimal text and some visual aids to bring information to life, really, for those people that need it. And we've got more information on our website for that. In terms of there's an inclusive communications resource that is now on our website. We've also got an inclusive learning hub, which is there for people to use as and when, and you can create an account. And I believe there's a new webinar that's a recorded webinar that you can listen to and look at in your own time. Again, really helpful for you guys who are volunteers, and your time is precious. So hopefully we've gone through, about improving a little bit of confidence and competence, and giving you a bit of fundamental kind of insight there in terms of those elements that we work to, and the organisations that we work with. And in terms of, we've looked at a little bit of inclusive and accessible comms. This is just a very light touch look at some of this, bit of a whistle stop really, in the 20 minutes, and we've got more information. Again, this information, we can go into it in more detail within the engagement presentation, which lasts about an hour and a half, and we'll go through a lot of that information in more detail. And yeah, we can bring that to life a bit more. So I will, I think, hopefully I haven't run over time too much, and I'll come out with the slideshow, and hopefully, if there's any questions, happy to take them.
That's great. Thank you so much for that, Paul. I know it was a very much a whistle stop tour, because you guys have so much information and fantastic resources out there. Has anybody got any questions for Paul? No, if anybody thinks of anything, yeah, just pop them in the chat, and if you've left us by them, Paul, I can pop them in an email over to you.
No problem at all. I think there was a hand that went up then, actually, but I don't know.
Oh, was that, did somebody raise their hand?
They did, yeah. I think I saw someone.
Jill.
Do you have a question for us, Jill?
Can you hear me? Sorry, I'm struggling to get my mute off.
Yeah.
Yeah, I did have a question, and then I was going to put it in the chat after you said, but basically, I mean, I'm sat here thinking a lot of the stuff you was talking about is useful if somebody's like, including, setting stuff up for people with disabilities. But so what I want to know really is whether you've got resources online and stuff that are suitable for existing clubs that generally have people that don't have disabilities, but might have people with disabilities that want to join. I'll give you an example for our Rounders League. We do have somebody who's deaf, and the simplest thing that we did was just chat to her and ask her what she needed from us, because we wanted to be inclusive and we wanted her to enjoy the experience. So it's that sort of advice and stuff. Do you have that sort of as a resource?
I think we have got quite a lot of information on our website. We've got some fact sheets that go into impairment specific. So I think in terms of for individuals that are already part of your that are part of a club, that maybe, because as some of the information sort of said, that there's doing that kind of I suppose, doing that understanding piece and doing that learning with and communicating with a group, you might find out that they have a long-term health condition that you didn't know about, And we've got, and so there's, and when you find that out, you might find that that they have a visual impairment or a hearing impairment that you didn't know about. So I suppose it's about adapting to that individual's needs, and that's where that person-centered approach comes in, and linking to those 10 principles. That's something that definitely does that. In terms of, I'm not sure if I understood the question, but in terms of sports specific stuff, we don't tend to have kind of sports specific information, but that's why we link closely with our national governing bodies of sport, and we can link closely with those other organisations that are impairment specific as well. So there's definitely, if we don't have the information, Jill, we can definitely find it, and then we can get it out to you if as and when you need it, really. Yeah, there's always support there to do that. Does that help?